Hi Calgary residents, we're back with another Dare to Diagnose. Hope you're excited, and let's get going. So here's your patient. You're doing a pre-op scan on a patient that's a known arteriopath with previous myocardial infarction and stroke. He has insulin-dependent diabetes and chronic renal failure on intermittent hemodialysis. You have imaging on file for a moderate decrease in LV ejection fraction 2 years ago. You decide to repeat this scan before you do the surgery. The planned surgery is a below-knee amputation. You're going to look at the echo, tell me what you think, and then come up with your anesthesia considerations and plan. And for this Dare to Diagnose, I think what I would like you to do is to get together in little groups. You can decide how you want to do it, maybe one from each year, maybe you want to pitch years against each other, and then submit your answers as a group. It makes it a little bit less personal. So when you're looking at the echo, first I want you to think, what are you looking at when you're looking at the images? So if you want to go back and review the normal echo loops before you look at this, that might be a good idea. I'll attach the link to this video. Then you want to decide, is this image that you're looking at, is it good enough to interpret? So you have to have a standard in your mind as to what a good enough image is. When you're going through the images, I want you to be systematic. So first look at all of the chambers, look at their size, their filling, and how well they're functioning. And then look at the valves, look at the morphology, are they thickened, thinned? And then look at their motion during opening. Are they opening well or not enough? And look at where they're touching when they're closing. So is there prolapse? And then look at the pericardium. When you identify pathology in your mind, decide whether this is mild, moderate, severe, and then is it clinically relevant? Okay, so this is what I want you to have in your head as you're looking through this following study. So we're going to start with our first loop here. Play that for a couple of minutes. You can have a little look at that. Okay, our next loop. So you can see I did quite a few of this just to try and get all the pieces in the picture, especially this right ventricular base was a little bit challenging to image. And there's your TAPSE. Loop. And this is a short axis from the subcostal. that was the right hemidiaphragmatic area here. Okay. Your second scenario is going to be, you've done the anesthetic, you're in the recovery room, and you're going to rescan the patient, and you will see the following. Okay, now in this recovery room, based on that IVC picture and the clinical scenario, so you've given this patient an anesthetic, blood loss was about 400, you've given 800 mils of Ringer's lactate. How would you manage this patient in recovery if their systolic was 60? Okay, so that's your Dare to Diagnose for this week. See if you guys can discuss it a little bit and come up with some answers to this question, to the questions. Firstly, what is the kind of primary diagnosis? What is your anesthetic plan? And then how would you manage the hypotension in recovery? And yeah.